now time to vote on the claims for improvement of your wages and conditions for the next Public Health System Award.
I'm really excited about this campaign because Ratios puts patient safety first.
It's about fairness and equity and about rolling out ratios to those that we haven't already been able to achieve a good ratio result.
What we're asking for in this next round of claims from the association to the government is to improve the ratios.
I think it will improve patient care.
As a nurse manager, I'll be able to ensure that the workloads are even, that the clients' needs are being met better.
It's going to be safer for the patients as well, and we'll have more time to conduct a comprehensive patient assessment.
Well, I think it will allow us to spend more effective time with the clients that we have, and it gives a safer outcome when you're not rushing between 20 or 30 people.
I now officially launch our campaign for Ratios putting patient safety first. We're here to make a big noise, and those who aren't here are with us in spirit. In their tens of thousands, New South Wales nurses and midwives demand one thing above all else: safe patient care.
It's time to get the right number of nurses in the right place.
What do you want? Ratios! When do you want it? Now!
It is unfair that the ratios are different in the city than they are to here in country hospitals like Goulburn.
A two-tier system where nurses are supported and staffed to provide first-rate care in some hospitals, mainly the cities, while their colleagues in others, mainly the country, are not, is unacceptable.
We want a better deal for the patients who are in emergency departments, who are in intensive care areas, who are in paediatric wards.
We must have enough of us to give all New South Wales patients in all wards in all New South Wales hospitals the same world-class care they now get in just some hospitals.
We're trying to provide a sirloin steak service on a sausage budget.
Mr O'Farrell, this is a simple claim. All the nurses are asking for is the chance to care for patients like we want to and like patients deserve. We want to put patient safety first.
We're back at this campaign level because more work needs to be done.
I was Health Minister when our government introduced improved nurse-to-patient ratios, and it's time the O'Farrell government listened to the nurses and acceded to their request for better patient care and increased number of nurses right across New South Wales.
The more nurses in emergency or right across the area means better service by definition to the patients.
We've reduced our falls by 36%, having 1 to 4.
It's about public patient safety, and that of course is probably the most admirable campaign any member of the workforce could carry on.
Here we are, only 20 minutes away from Westmead Hospital, and yet a 20-bed ward at Blacktown Hospital gets 70 hours less of nursing a week.
I'm very worried about what's happening in our health system generally. We've seen $3 billion of cuts to the hospital system under this government in just 2 years. We've seen wards and beds closed at Prince of Wales Hospital. We need patient ratios, and we will stand with you to make sure that we do everything in our power to support you achieving that outcome.
Well, I'm here to support the nurses in my electorate that service this fabulous hospital here at Shell Harbour to see increase in nurse numbers. Taxpayers, residents, members of the Nursing Association, every resident of New South Wales wants to see governments provide the best hospital care that we can provide.
These nurses look after our families, they look after our friends, and we need to look after them.
What we need to win this campaign is community support. And I urge you to take some leaflets with you, letterbox your street and get the community behind us, because that's the only way we're going to get support for this.
And we need to make sure we rally behind this campaign, and I'm grateful for the badge and I'll be wearing it with pride.
Ratios put patient safety first.
We just had a meeting this afternoon with Brian Doyle, who was kindly enough to meet a small delegation.
Brian was very receptive to our cause. Stephen was quite happy to come out and have a look at Campbelltown Hospital.
We asked him if he would support us in our claim for equal hours with our city counterparts. We just said, why should we be any different?
We visited with Kevin Anderson, our local MP. We've had a very good reception from Kevin, and he's very supportive of the local nurses in that area.
Yes, we've just concluded the meeting with Mr Owen and put forward our case for fair nurse ratios across all sectors.
He did take all our suggestions on board, and some of the notes that we had presented to him he was going to look into further.
Is the Premier listening?
We're asking members now across New South Wales to deck your desk. Take a few minutes to put those decorations up around your nurse's station, around a desk area, in your tea room or other appropriate place, at your place of work. Fill in the branch name on the sign, take a photo, send it into the association and send it to your MP.
Well, May Day is a very special day right across the world, and nurses and midwives, like other workers, have had to struggle hard over centuries to improve working conditions and to fight for a better society. And today's May Day is no different to that. We are still engaged in important struggles. We're engaged in a struggle to continue to deliver safe patient care. In order to do that, we're trying to expand our nurse-to-patient ratios into areas where we don't have them and to equalise them where we do have them.